Everybody, welcome back to my YouTube channel. Hope you all are doing well. This lecture is a continuation of my previous lecture on veins or vein system in head and neck and thorax and abdomen. And with this lecture, I will cover topics like coronary sinus, lymphatic system, cisterna chyli, and lymphatic duct. So before I start the lecture, please like, comment, share, and subscribe to my YouTube channel. So without any further ado, let's jump right into the lecture. Alright, let's start with coronary sinus. So coronary sinus is a collection of veins that join together to form a large vessel. It collects blood from the heart muscles, myocardium, and it delivers the deoxygenated blood to right atrium, like superior vena cava and inferior vena cava. So coronary sinus starts at the junction of great cardiac vein and the oblique vein of the left atrium. So in this picture, you won't be able to see the oblique vein, but here you can see the great cardiac vein, which actually runs both anterior and posterior side of the heart. So you can see great cardiac vein this is the anterior side of the heart and this is the posterior side of the heart. So it runs in the interior part and it also runs at the posterior part of the heart. And the coronary sinus runs transversely in the left atrioventricular groove on the posterior side of the heart. You can see here coronary sinus. So atrium and then ventricular. So together they make the groove. So that's where the coronary sinus runs. So as I mentioned before, the coronary sinus receive blood from 5 different veins. You can see the tributaries of coronary sinus. So great cardiac vein, middle cardiac vein, oblique vein, posterior vein of the left ventricle, and small cardiac vein. So the mnemonic for all these tributaries is great mops. And there are 3 important things you need to remember for coronary sinus, just for the exam purposes. First, this is a continuation of a great cardiac vein, as I mentioned before. Second thing is that all hard veins drains into coronary sinus except the anterior cardiac vein, which actually drains into the right atrium directly. And the third, if you have an embryology question, so the most important question regarding the coronary sinus would be the development of coronary sinus is from the left horn of the sinus venosus. So if you see this diagram, this is in heart in embryo at the age of 26 weeks. So the right horn of the sinus venosus, so if you can see this is sinus venosus, and the right horn, so this is the right hand side, this is the left hand side. So the right side of the sinus venosus, it forms the venous portion of the right atrium between the vena cava. So you can see the light blue color, that's the venous portion of the right atrium, and it's between the superior vena cava and inferior vena cava. While the left side of the sinus venosus forms the coronary sinus. So you can see here the coronary sinus is in purple color. So the next slide is lymphatic system. So if you don't know about lymphatic system, then let me just explain a little bit about it. So your lymphatic system is a part of your immune system and has a lot of functions. The main function is it actually saves you from a lot of infections. And if you have problems with your lymphatic system, you're probably going to get edema. So you must have heard of this term a lot. So lymphatic system is a network of tissues, vessels, and organs that work together to move a colorless wet fluid called lymph back into the circulatory system, which is also known as blood. So it has few components. If you can see the diagram, there are different components. Like one component is the lymph. The first component is lymph itself, and the second is lymph node. The third one is lymphatic vessels, and the fourth one is collecting duct. So these four together makes the lymphatic system. And of course, these four components takes the lymph from extracellular area where the capillaries are not capable of reabsorbing the extra fluid. So you can see here in this diagram, the arterial system and the venous system, they both merge at capillary level, and that's where the lymphatic vessels joins the capillary system to drain the extra fluid from the tissue. Alright, so like lymph nodes, there are around 6 to 7 major organs that helps filter the lymph. For example, the palatine, tonsil, thymus, appendix, and large intestine, and bone marrow. Along with that, spleen, which is the biggest organ that filters lymph. And there are pair patches in small intestine. So there are a couple of terms that you need to remember are lymphadenopathy and the lymphedema. So lymphadenopathy is an enlarged swollen lymph node which is caused by infection, inflammation, or cancer, whereas the swelling or accumulation of fluid is called lymphedema, which is due to the blockage of the lymphatic system. That could be because of the scar tissue from a damaged lymph vessel or node. Another important thing you need to remember is the cancer associated with the lymphatic system, for example, Hodgkin lymphoma and non-Hodgkin lymphomas. In the next few slides, I will discuss about the right lymphatic duct, the thoracic duct, and the cisterna chyli, which are part of the lymphatic system. So let me start with cisterna chyli. So cisterna chyli is a dilated sac at the lower end of the thoracic duct into which the lymph from the intestinal trunk and two lumbar lymphatic trunks flow. So it receives fatty chyle from the intestine and thus acts as a conduit for lipid products of digestion. So as a few things that are important in relation to cisterna chyli. First, it drains lymph from these four regions. So you can remember a mnemonic pair. And few other important things are that cisterna chyli is a retroperitoneal structure. It is posterior to abdominal aorta. So when I'll be moving to the next slide, I'll show you. And this is anterior to D12 thoracic vertebra, or L1 and L2. So you can see this is the cisterna chyli here, and right now it shows you right in front of L2 vertebra, but it could be anywhere in the range of T12 to L2. And thoracic duct is the continuation of cisterna chyli. So these four things you need to remember when it comes to cisterna chyli. Moving to the next slide, thoracic duct. Let me turn on the pointer. Alright, so thoracic duct is the larger of two lymph ducts of the lymphatic system. So if you remember in the earlier slides, I mentioned about collecting ducts. So one of the collecting duct is right lymphatic duct, and the second is the left lymphatic duct, which is also known as thoracic duct. So this duct actually is a continuation of cisterna chyli, and it also drains blood from the left side of the body. So you can see here there are only few areas from the body that actually drains lymph to the right lymphatic duct, but majority of the body drains lymph to the thoracic duct. So there are 6 things that you need to remember for thoracic duct. So first of all, very important that it is located in posterior and the superior mediastinum. Second, it empties at the junction of left subclavian vein, right, the left subclavian vein, and the left internal jugular vein. So right here, this angle is known as Pirogoff angle. And thoracic duct again is a continuation of Cisterna Chyli, as I mentioned before. The jugular trunk or deep cervical lymph node drains into the thoracic duct. So thoracic duct passes through diaphragm at the level of T12 along with aorta. So this could be one of the important questions that can come in the exam. So always remember that along with aorta, thoracic duct passes through the diaphragm. 6th point, I have already mentioned that the thoracic duct carries lymph from all body except the right upper limb, right breast, right lung, and right side of the head and neck. All these areas drains lymph to right lymphatic duct. So if you remember in the previous slide, I mentioned that, let me just go back to the previous one. So the Cisterna Chyli is posterior to abdominal aorta. So you can see here, this is posterior side, this is anterior side. So Cisterna Chyli is posterior to the abdominal aorta. And that's it for this video. Again, please like, comment, share, and subscribe to my YouTube channel. It'll be really good support to me and also for people who are looking for these kind of videos on YouTube. I'll be launching more videos, but until then, please stay safe and educate others. Thanks and bye.